Wonderful. Okay. All right. Good morning, everybody, and welcome to our Health to Hold Community Resource Webinar Series. My name is Jenna Sistad, and I am with the Ocean Monmouth Health Alliance. We host this once a month, and we recognize all the awareness months. And this month happens to be Skin Cancer Awareness Month, along with some others. I know it's Stroke Awareness Month and Mental Health Awareness Month. But for the sake of cancer and chronic disease prevention, which our coalition covers, we're going to be highlighting skin cancer awareness. And so we have Gabby here with us from Rutgers Cancer Institute of New Jersey, and we are looking forward to hearing a little bit about what they do and taking us through some education on skin cancer. So thank you, Gabby. We appreciate you being with us. And before I toss it over to you, I'm just going to ask that folks sign in, let us know in the chat who's here, and also keep yourself on mute until the end. We will have a space for Q&A. So thank you so much and welcome. Thank you, Gabby. I'm going to hand it over to you.
Awesome. Hi, everybody, and good morning. Thank you for joining us today, and thank you, Jenna, for having me and for the kind invitation. So today I'm just going to tell you a little bit about what we do at the Rutgers Cancer Institute, and we will be doing a short educational series about National Skin Cancer Awareness Month. So at the Rutgers Cancer Institute, hopefully most people are familiar with you guys. Hopefully the big R is kind of a giveaway. We actually recently just changed our logo. So now, we'll be affiliated with the actual big R instead of the full name. And we actually took the New Jersey part out. So now we're just Rutgers Health, Rutgers Cancer Institute. So you might see a few changes and emails going back and forth or any of our flyers that are going out. But a little bit about the arm that I work for. So I work for the Community Outreach and Engagement Team at CI&J, I guess. And what we're committed to meeting the cancer-related needs of communities across the state. And so in my role, we do a lot of educational series. We do tabling. We provide resources for our partners. And with the educators, we have people that are bilingual. So we're able to do presentations in both English and whatever language you're looking for. Since New Jersey is such a diverse area, we like to make sure that we have materials translated properly and that we're able to give, culturally sensitive topics through education. And so again, our mission at the Cancer Institute is to advance cancer health equity throughout the entire state. And we do focus on the underserved populations through community capacity building, participatory research, advocacy, and patient navigation, which I'll even talk about a little bit more at the end. And so we strive to be a national and global leader in achieving the cancer health equity to reduce the cancer burden and just improving recruitment of diverse populations for clinical trials in New Jersey and beyond. And so if anybody has any questions, even at the end of the presentation about our specific department or even Rutgers Cancer Institute in general, please feel free to ask. And so we'll go into the presentation today about National Skin Cancer Awareness Month. And like Jenna said, I know that there are other chronic diseases that are also this month, but this is one that we do like to highlight, especially since the weather is getting much warmer. I know the area that I'm in right now, it's going to be, I think, a high of 85 degrees today. So I think people are starting to think, okay, it's Memorial Day weekend. Are we hitting the pool? Are we hitting the beach? And so this is something that I think a lot of people overlook when it comes to sun safety. And so again, my name is just Gabriella, and I am a community cancer control specialist. And then we're just going to talk about today about some sun safety for skin cancer prevention so that if you're out and about this weekend, you'll be safe while being able to enjoy the weather as well. And just as a quick disclaimer, we always have to put this in. The information contained in this presentation is not a substitute for medical consultation. A physician should always be consulted for any health problem or medical condition. All logos, text, and images used in this presentation are the property of the respective copyright owners and are used here for educational purposes only. And if you would like to use any portion of this presentation for non-personal or educational use, please contact the meeting host or presenter for express permission. And so here we just have these skin health objectives and a little bit about what we'll be talking about today. So we're going to cover understanding skin cancer, screening and risk factors, and identifying ways to prevent skin cancer. And so what is skin cancer? Before we even go into skin cancer specifically, we need to discuss what cancer is. And so a very basic definition of what cancer is a disease in which the abnormal cells divide uncontrollably and destroy body tissue. And so cells in the human body normally, grow, multiply, they form new cells as the body needs them. But sometimes this process, becomes damaged, it breaks down for one reason or another. And so these abnormal or damaged cells just continue to grow and multiply. And so with skin cancer, it's specifically the out of control growth of abnormal cells in the epidermis, otherwise known as the outermost skin layer. And that's caused by the unrepaired DNA damage that triggers these mutations, destroying the cells. And we're going to talk a little bit about the main types of skin cancer throughout the presentation today. And so in order for us to understand skin cancer, we have to understand the anatomy of the skin. The skin is the largest organ of the body, and it protects it from infections, injury, and the sun. It also stores water, vitamin D, and fat. And so while there are many layers to the skin, we're only going to be focusing on two main layers today. So you have the outer layer, like I mentioned earlier, the epidermis, and the inner layer known as the dermis. And this is important. Cancers actually begin at the epidermal level. And so when a skin cancer actually becomes more advanced, it generally grows through this barrier and into the deeper layers, like we're going to see later on. So you have three types of cells in the epidermal layer, the outermost layer. You have your squamous cells, which are the flat cells in the upper or the outer part of the epidermis. And these are the ones that shed as the new ones form. So when people say you should be changing your bed sheets, pillowcases, it's because you're thinking of all those cells that are coming off throughout the night, or even, throughout the day. And then you have your basal cells, which are in the lower part of the epidermis. And those are the ones that are dividing to constantly form new cells to replace all those cells that are dying off. And then you have your melanocytes, which make melanin. And they actually give the skin its tan brown color. And melanin is actually an amino acid. And it acts as the body's natural sunscreen. So it actually protects the skin layers, all the way from the epidermis down to the dermis. And then you have the basal cell carcinoma and squamous cell carcinoma. So these are the most common types of skin cancer. And they start again in the top layer of the skin, otherwise known as epidermis. And these are often related to sun exposure. And so you have basal cell, which is the most common, found anywhere on the face, head, and neck, and they usually grow slowly. And I will say the silver lining with basal cell carcinoma and squamous cell carcinoma is that they rarely metastasize, meaning that it's slow to spread to other parts of the body, unlike melanoma, which we'll cover later on, which can spread very quickly. But also with squamous cell carcinoma, you can find them anywhere, face, ears, neck. I know people who have found it, between their toes, between their fingers, behind their ears. So anywhere that can have sun exposure. And they can even develop on scars or sores. And unfortunately, squamous cell is more likely than basal cell to grow into the deeper layers. And then you actually have AKs or actinic keratosis. I probably butchered that a little bit. So we just like to call it AK, but it's actually called solar keratosis. So it's actually a precancerous skin condition which is also caused by too much sun exposure. And so this is just kind of the two images on the right-hand side are just a visual of what basal cell and squamous cell may look like. Again, this is not what the presentation may be for everybody, but this is something that, we see with common presentation. And so now we're going to discuss a little bit about melanoma. So melanoma is when the melanocytes start to grow out of control. Again, we talked about this earlier where melanin produces the tan, darker color in your skin, and it acts as the skin's natural sun protection factor. But melanoma is much less common than the other types of skin cancers that we did talk about. But we do like to focus on this because, unfortunately, it is the most dangerous because it's most likely to spread rapidly to other parts of the body. And so these melanoma tumors, as you can see on the right-hand side of the screen, are usually brown or black, and they may resemble moles. And we've seen it more likely to start on the trunk, so the chest and the back for men and the legs in women. And so you see in that image on the bottom right-hand corner that melanoma, unlike some of the other cancers, penetrates very deeply into the other skin layers, hence why it's so dangerous and is able to spread so quickly. And just a few melanoma statistics. At the Cancer Institute and with education and engagement, we constantly push for early detection and preventative screenings. So we know that melanoma accounts for only about 1% of skin cancers, but it unfortunately causes the majority of skin cancer deaths. And the American Cancer Society actually put out a statistic saying that there's going to be about 100,000 or 97,000 new melanomas diagnosed this year alone. And with early prevention and early detection, we know that 99% is a 5-year survival rate for patients whose melanoma is detected early. So again, we know that early detection makes a difference and that screening does save lives. And so now we have a slide here on skin cancer. So what does skin cancer actually look like? Keep in mind that not all skin cancers have the same appearance. These photos serve as more of a general reference for what it can look like and what it's appeared like for others. But like we always say, when in doubt, check it out. So if you have an unusual spot or blemish on your body, please refer to your physician or to a dermatologist, and they're able to get a closer look on that. So you have basal cell carcinoma, again, which can appear on the face, the ears, the neck, scalp, shoulders, and back. And it kind of always looks like an open sore that doesn't heal. It can have reddish patches, kind of looks irritated. It can even be shiny and kind of appear like a small pink growth or like a scar-like area. Then you have your squamous cell carcinoma, which can develop in scars, like we talked about, skin sores and other areas of maybe skin injury. But they're often rough feeling, crusty, or have scaly bumps. And then you have melanoma, which we talked about earlier, can have shades of tan or brown and can have those black marks that you see. And with melanoma, you can have areas where they're exposed to the sun, but they can also appear in areas that are even sun protected areas of the body. So even if you're wearing long sleeve clothing and stuff, unfortunately, melanoma can still develop in those areas. And then you have something called Merkel cell carcinoma, which appears as a pearly pimple-like lump, and it actually is more common. So this one is something that's a little bit more rare and an aggressive form of skin cancer. And it actually develops from a virus called Merkel cell polyomavirus. So this is something that can be catalyzed by UV radiation exposure. But this is something that if you do see this, that's something you should discuss with your doctor about. And it usually is present in individuals over the age of 50. And then this slide here, I do really like because I feel like it gives a good picture example of, skin cancer stages and the sizes that we're going to talk about when it comes to melanoma. So on the left, you're going to find the stages of melanoma. So in stage 1, you see that the cancer is only about 1 millimeter thick and then increases in size. So by stage 4, the cancer has spread to other parts of the body, such as the lungs, the liver, the brain, soft tissue, muscle, which is how it's penetrating through those arteries and veins, and distant lymph nodes. And so the pencil and crayon on the right is a good benchmark for gauging the size of an unusual mole or spot. You can measure the spot to see if it's grown in size from that of a pencil tip, which is about 1 millimeter to about the size of a pencil eraser. So about 5 millimeters. And, just keep in mind again that while melanomas are, start at about less than 1 millimeter, they can be even smaller than that when they're first detected. But this is definitely a good benchmark to keep in mind. Then you have your risk factors or high risk factors. And so a risk factor is anything that raises your risk of getting a disease. And so anyone can get skin cancer, but people with certain characteristics are unfortunately at a greater risk. And you have things like your modifiable risk factors versus non-modifiable. For example, the risk of melanoma unfortunately just increases with age. The average age of diagnosis is around 65. However, melanoma can also, be common among those under the age of 30. And right now we've been seeing research to show that it's one of the most common cancers in young adults, especially young women. And so while melanoma rates, mortality rates or death rates have declined rapidly over the past decade, we have seen, advances in treatment and especially in awareness. And so some of these risk factors that you can control, your excessive exposure to sun or UV rays, smoking. We have seen patients with squamous cell carcinoma on the lips, so it's something you can avoid as well. But then some other things you can't avoid are your family history. Your genetic makeup might cause about, I think it's about 10% of skin cancer cases that have been reported having many moles. So those that are large, irregular, you have maybe more than 50 on the body. Those who have fair skin, freckling, light hair. So we're going to talk about the importance of wearing a hat, sunscreen, even long sleeve clothing. And unfortunately, having a weakened immune system is a little bit weaker and, maybe more susceptible to other chronic diseases. And so what can we do to prevent skin cancer? And we like to use the ABCDE rule to detect it. And it's an easy rule to remember what you're looking for. So melanoma can appear as a new growth or from a mole that already exists, like we talked about earlier. And so this is just an easy way for you to remember what you're looking at. And so if you see any of these on your skin, please don't panic. I'm not trying to scare anybody. Statistics show that most skin lesions and moles are not cancerous, but again, it's always best to get checked out just to be sure. You can catch skin cancer before it becomes life-threatening. And so if you have a suspicious mole or lesion, make an appointment to see your physician as soon as possible. So with the ABCDEs of melanoma, I like to talk about asymmetry. So if you see one half of the mole does not match the other, as you can see in that photo, it kind of looks like the mole is a little bit like migrating. So one half is darker, the other is lighter, and it appears to almost be separate. Border, if the border is irregular, so it has a jagged border, scalloped, it's poorly defined when it should just be a perfect circle. Color, if it has varying colors from one area to the next, so shades of tan, brown, and black, it should only be, one distinct color. Diameter, like we talked about, a change in size, so usually an increase. Melanomas are usually greater than about
Hey,
6.
va a ir Johnny contigo.
And then evolving,
Lo que pasa que pues no.
over time in size, shape, or color. So If you have any of these symptoms or you see them on the mole or spot on your body, take a photo, mark it. And then when you go see your doctor, discuss with them some of these issues that you might be having. And so here we always like to say you have to be your own detective for your skin. So on the left is what a normal mole may look like from patients that we've seen. So they're round in shape, they're one color, etc. And then on the right is what would abnormal moles or melanomas look like. So they have the irregular borders, they have the varying colors, they're migrating, they look like they're evolving in size. So that's just a good benchmark of what to look for on your own body. And now we're just going to talk a little bit about sunscreen and some screening methods. And so while there are no official screening guidelines yet, unlike, those for breast cancer or for colorectal, going for screenings every year, every 3, every 5 years, there are actually no official screening guidelines when it comes to skin cancer. However, doctors do recommend checking your own skin regularly, typically once a month, and even going for regular self skin exams with your provider. So your general practitioner or a dermatologist. And so even without the official screening guidelines, we do not want to minimize the importance of skin cancer screening. Instead, I feel like this should actually motivate us to improve, the different ways that we identify groups of people who may, be at more risk for skin cancer. And then you have your screening methods again. So your screening methods can include examination by your healthcare provider or even by yourself, a visual self-exam, or through the clinical examination. And so if you do have an abnormal exam, a skin biopsy may be recommended by the dermatologist or the doctor. And this usually includes the removal of a suspicious tissue. And then the sample is sent to a pathologist and they check for cancer cells under a microscope. And so annual skin checks with the dermatologist are important because they're able to catch skin cancers at their earliest. So that way, if it is found, the most appropriate treatment plans can be discussed and established. And then this is just a good graphic regarding what a skin self-exam may look like, something you should be doing at least once a month. Most people like to do this after a bath or a shower, and they usually use a mirror. They check any moles, blemishes, or birthmarks from the top of your head all the way down to your toes. And so if you look at your skin regularly, you do know what's normal for you and what's abnormal. And, we always say to take good close-up photos concern. And if you need help, you can always have a partner or a loved one help look at the areas that are hard to see. And just some things that we can do to minimize the daily risks. Applying sunscreen. We know that UV radiation is reflected by sand, water, snow, and it can even go through windshields and windows. So even on the cloudy days and in the winter months, you need to apply sunscreen. Especially occupations that are based outdoors, such as farm workers, construction workers, first responders should definitely wear sunscreen and reapply regularly throughout the day. But other things that you can do to protect yourself, you can wear a wide brimmed hat and sunglasses. You need to also ensure that you're protecting your eyes as well. Wearing long sleeve clothing, things with ultraviolet protection factor fabrics, and just to seek shade when possible. Just staying hydrated and making sure that you're not exposed in the sun for too long. And applying sunscreen, we always like to talk about this because sunscreen is designed to protect your skin, to help protect that natural skincare barrier. So we always say to go for SPF 30 and above, again, which stands for the sun protection factor. Make sure that the sunscreen that you have is water resistant and check the expiration dates. I know that a lot of people will have their sunblock in their medicine cabinet for a year and then not look at it again until the next summer. And so it's always important to check those expiration dates before you use them again. Make sure it's broad spectrum, so it covers UVA and UVB rays. So those are the rays that are associated with skin burning and skin aging. You always need to apply about 30 minutes before going outside. It does need time to absorb into the skin. And if you're swimming or you're sweating, you do need to reapply every 2 hours or so. Make sure you're covering your body generously. You include your ears, your hands, your feet. And it's also important to use a lip balm with SPF 15 and above. It's important to keep your lips moist and to keep them from burning or from being chapped as well. And so for a lot of people, they'll say often at presentations, I don't like using sunscreen because of the way it feels. It's sticky. I'm allergic to it. But nowadays, there are tons of even makeup products, moisturizers that do include SPF built in already. So it's the small things that you can do. Let's say your moisturizer in the morning already has SPF. It's definitely the little things just to keep your body the most protected as you can. And so we're just coming to the conclusion of the presentation. So just the take-home messages, if you have not paid attention to anything I have said the entire presentation, these are just the things I would love for you to take away. So we know that all skin tones are at risk for skin cancer. Unfortunately, skin cancer does not discriminate. So whether or not you are the fairest person or the tannest, you are at risk for skin cancer. You can follow the ABCDE rule to detect skin cancer. Again, any of those changes. Do a self-examination on your skin about once a month. Get screened and discuss abnormal skin changes with your physician. Avoiding tanning beds, suntan lamps, and excessive sun exposure. And then your sun safety tips. Wearing broad spectrum sunscreen daily and applying every 2 hours. Seeking shade when possible. And then wearing protective clothing. So long sleeves, wide brimmed hats, sunglasses, etc. And that actually comes to the conclusion of our presentation. If there are any questions, I'm able to take them if we have time, Jenna. And if you would be so kind to use your smartphones, use this QR code just to give us an evaluation, let us know the things that we did well, the things we can do better. But we appreciate your time and thank you for joining me today.
Thank you, Gabby. Always learning something new from you guys. The ABCDE is really, really catchy. So I hope people can hang on to that. Does anybody have questions for Gabby? If you would like, you could take yourself off mute and ask, or feel free to put something into the chat box. We can pick it up there as well.
Hi, I have one question.
Sure.
When you put the sunscreen on the face, you put it in the morning, right?
The sunscreen?
Uh-huh.
Yeah, you can put it in the morning, anytime that you would be going outside. So I like to do mine in the morning because it's actually already built into my moisturizer. So I like to put it in the morning just so I don't forget. But let's say, you're at the beach in the afternoon, you do have to apply it about 30 minutes beforehand. And then even when you're outside, if you're still sweating or you're swimming, you still need to reapply it every 2 hours. So it's always good to have it on hand. I know they come in like little travel sizes as well. So
Okay, that's my question. Because every morning I put on my face, and when I go outside, I'm sweating or I'm running, and
Mhm.
I leave it my face like that. So I need to put again after sweating.
Yeah, especially if you're sweating a lot. So if you're working out, it's always good to reapply or to even wear, if you're running outside, to even wear a hat. I'll usually wear a hat also just to give myself a little bit more protection, or even wearing sunglasses as well, because you also want to protect your eyes from all of that UV rays that you have as well.
And which protector for the skin you recommend?
It really depends. I don't have, a specific recommendation. Like I particularly use like a Neutrogena type of moisturizer that already has SPF built in. But if you go to the pharmacy, Target, Walmart, they have tons. And with each person, it's very individual. Some people can be allergic to some ingredients in sunscreen like zinc or oxide. So you can use like a chemical sunscreen versus a physical one. It really depends. It's always good to try them out just to make sure your skin can handle it. So it's going to be different for everybody. But I myself personally use Neutrogena, but that might not be the same for everybody. So
Oh, okay. All right. Thank you.
yeah, you're welcome. Thank you.
Thank you, Evelyn, for asking a question. Does anybody else have a question for Gabby?
Hi, good morning. I have a question. So when I wear a lip balm that is, SPF, whatever, I have tried different brands, but I always feel the burn, and they always are like peeling off. So what do you recommend in that case? Because I have tried different brands, types, and none of it worked.
Specifically for lip balm
For the lip,
specifically?
yeah, for the
Oh, for
lips.
lip balm. Um, that's interesting. I honestly, you might be allergic to something maybe in the lip
Mm.
balms that they sell at the pharmacy or things. I would even just ask a doctor, dermatologist, because you might need something maybe more specific, maybe something that doesn't have specific ingredients. Because I know I just use like the traditional lip balm that has SPF. So whatever they have at the pharmacy, like EOS or anything like that, that's normally what I would use. But since it seems like your skin might be more sensitive to it, maybe I would ask like a doctor if they have like a recommendation. Maybe there's something more clinical that they can prescribe just to protect your skin. Unfortunately, I wouldn't know any of the ones that I've never had a clinically prescribed lip balm. So that would actually be interesting.
Okay, thank you so much.
Mm-hmm.
I have a question. Can you hear me?
Yes.
Yeah.
Thank you, Gabby, for that. That was great. Actually, yesterday I went to the dermatologist with all of my kids because they have like birthmarks. I have a lot of birthmarks, and but one of my kids, the little one, he's 8 years old. He's developed a white patch, which they called it. It's not vertigo. It's something like that, but.
Oh,
And I was just concerned because they said, oh, that part doesn't have any melatonin. It needs like extra protection for the sun. Like, would that make them more at risk of like sun exposure of all this stuff? Like, can you like maybe talk a little bit about people that have skin conditions that may require extra protection or extra to prevent this stuff from developing?
yeah, definitely. That actually came up also in the last presentation we did. We had a woman whose child had like a very severe form of like eczema. And so, when her child goes out, she did ask the dermatologist and the physician on what she should do. And with her child, she does have to always apply extra sunscreen more often. Like they said that like that area either doesn't have more melanin, so it lacks more of that natural border that protect it. And they have to unfortunately reduce, the child's exposure to the sun. So they can't be outside as long as some of the other kids can. Always have to be wearing a hat, something maybe with long sleeves, anything like that, just because the skin unfortunately is a little bit more sensitive. So even with other patients who have very fair skin, like we've seen patients that have like redheads almost, will actually have like melanoma on their scalp because their hair is so thin and so light. And so the light passes through. And so they always have to go out, things like that. So unfortunately, I feel it's like extra steps because you have to always be on top of it. But it definitely makes them more susceptible to, skin cancer because of the exposure, because they don't have that natural boundary as much as others may have. So
Thank you so much.
yeah, thank you.
These are great questions.
Yeah, they are.
Does anybody have another question for Gabby? don't see anything that came through the chat. I actually have a question too, Gabby. I was wondering if you have a preference or can speak to like the lotion versus the spray. I know like some people just want to spray their kids because it's quick and their kids don't want to be like
Yeah.
staying still for too long. But I also know that that's maybe not the best. I don't know. Can you talk a little bit to that?
Yeah, I know we've talked about that a little bit too. Like we haven't done tons, like I specifically haven't done tons of research into, the spray versus the lotion. But we know that with the lotion, because you're rubbing it into the skin, it helps it absorb better. So, usually we can show like a diagram in person of what the skin will look like because it's literally an invisible barrier. So having something that you can rub in and that can absorb, they will say, is always a little bit better than something that just gets sprayed onto the skin. I don't think it absorbs as well as they would say. But for people who don't like using the lotion, it's better to use a spray than nothing at all. Some people will say, well, I don't want to use it. But then use a spray. That's fine. If that's something that you prefer, it's definitely better to have that than to have nothing at all. But I think some of the research does show that the lotions that are rubbed in just have better absorption and just kind of stay on the skin a little bit longer than the spray on option.
That makes sense. Yeah. Okay. Sounds good. Thank you.
Mhm.
Does anybody else have another question for Gabby? Okay. All right. Hearing nothing, I'll assume there are no more. I would like to just again thank you, Gabby, for doing this with us. And it's always great to partner with you guys. And I always learn something new whenever I hear you all present. So thank you. At this time, I just want to give a couple of OMHA updates, future events that are coming up, and then we can buy back some more time in our day. So this particular series, Our Help to Hold, will be happening again on Wednesday, June 26th. It will be happening from 10 to 11 a.m. virtually, and it will be highlighting Men's Health Month. We have Monmouth County Health Department as our highlighted speaker, so we're looking forward to that. And then the other thing that we have happening in June is on June 12th, we have a Having Your Say presentation, and what that is a talk about the importance of creating a living will. It's going to be about how, you can help your family come up with a plan together now before, you're put in a position where your family may have to make very important medical decisions for you unexpectedly. So to just have a proactive approach to that rather than a reactive approach. So I'm continuing to send the flyers and the information about both of those out. And please feel free to join us and or share it with others who you think may be. So that's that. Angie, did you have anything else or did you want to share anything before we conclude?
I think we're in the breathworks. We're gonna probably do that on June 11th. So it is, I'm not sure if it's gonna be physical or through Zoom, and we'll finalize that. I am meeting with Ms. Tiffany sometime next week, and we will follow up with those updates as well.
You're right. Thank you for mentioning that. So we'll be partnering with Neighborhood Connections to Health to promote a breathwork session. It's going to be at a local park in Freehold. It's going to be held in English and in Spanish. So like Angie said, more info to come. Thanks for bringing that up, Angie. All right. Well, thank you, everybody. We appreciate your time this morning and joining us, and we'll see you all soon. Happy Wednesday.